Hi, folks. Let me see if I can do this. So I'm going to talk about a set of projects that we've had that have been HRSA-funded, and Bill England gave me a great setup for this yesterday when he mentioned a bunch of their efforts. And I particularly want to tell a story, and everybody in here has heard about Tele-ED, so I don't have to tell you what that is. One of our first projects was to look at HIMSS analytic data, to find out the rates of telemedicine. If you ever look at that, you won't believe the numbers, they're so low. But in terms of ranking for departments, Tele-ED is one of the more popular hospital-based applications for telehealth. So we know that it's live video and hub and spoke. What we did for one of our projects, and this was Mathematica was the prime, we were a sub to them, this was a HRSA-funded contract, and the purpose was to identify measures with the idea that if we could identify telehealth measures that were appropriate for EDs, that then when we embark on multi-site studies, this would be a good basis for that. So when we started the project, it was sort of in the world out there, how could we identify these measures? So first we did a systematic literature review, and Elise gave me a great setup for that. Then we went shopping for standardized measures that are already listed someplace, scored those measures, I'll talk about this more, and identified a final set. So when you shop for standardized measures or you do a literature review, you want some sort of a conceptual framework, a set of domains for measures to fall into. And luckily, AHRQ has a National Quality Measure Clearinghouse, and this is their framework for identifying domains and subdomains for measures. They've got a whole nother half of this, bottom half of this, not on the slide, that has to do with population health. But in terms of Tele-ED, these are the domains and subdomains that make sense, and we applied that. It was wonderful to find this. We applied it as we went looking for measures to categorize them. So first we did a lit review. Part of us coming into this project, we already had a systematic review of Tele-ED, and we had found 38 studies. We updated it as part of this project another years and found 50 studies that were on Tele-ED. Looked at all the measures that were reported in the empirical studies, found a set of those, and this is using that categorization scheme, these are the sort of measures that are reported in the literature for Tele-ED. You'll see that most of these follow into the domains. If you memorize that previous slide, they follow in, but telehealth, the bottom two, a lot of our literature reports on technical quality, and we've showed in terms of Tele-ED, we've got great quality in terms of the technology works. A lot of early studies looked at that agreement between the hub and the spoke in terms of scans or diagnostic accuracy or whatever. That has been established. What's unique maybe is averted transfers in terms of the ED. That's getting reported in the literature. That's not something that is probably common to a lot of other applications for Tele-ED. ED service time, that's a very popular measure. So extracting the measures from the studies that were out there was a first step in this. When you do a systematic review, you find out that a lot of our literature, our empirical studies, are pretty weak in terms of the methodology, but there's a lot of support for technical quality, for user satisfaction. There's also support for the process measures, the outcome measures, disposition, but the studies are not that well done. Economic outcomes, the studies in the literature, when we looked at it, were really poor, and so don't offer much guidance. So the next thing, after we did that systematic literature review, then we went looking for existing measures. And first we went to AHRQ's National Quality Measure Clearinghouse, which is a wonderful tool if you're looking for measures. They've got hundreds and hundreds. You can put in search terms. We put in emergency department, emergency medicine, and up pop a whole bunch of measures, and those folks that work in that domain know the CMS measures that have to do with aspirin on arrival for AMI patients, those sorts of things that have been around for a decade or more. And so those are well documented in there. You find a bunch of other measures. These measures of support are submitted by organizations, go through a review process, and end up in that clearinghouse. NQF is also the big gorilla in terms of looking at measures, going through a very systematic process of evaluating those measures, and if they endorse those measures, those are all available. You can look for those. So what this slide shows is, first when we looked at emergency department and emergency medicine, we found quite a number of measures through the AHRQ site, through CMS, NQF, those sorts of things. Now, somebody like Judd might say, but the American College of Emergency Physicians has measures out there. They all replicated and just referred back to the CMS measures, or a number of these organizations talked about measure concepts, but we put the criteria. They had to at least give us a definition of what that actually meant. They couldn't say economic outcomes without any other information. Ideally, and if you go to NQF or the National Quality Measure Clearinghouse, they'll actually give you the numerator and the denominator and very clear definitions and exclusion criteria, and that's what you really want when you're trying to move forward with measures, especially if you're going to use them in a multi-site study. So very clear definitions. When we looked for telehealth measures, in those sorts of sites where we could put in a search term and the answer would pop up, we found nothing. I just looked the other day in terms of the AHRQ site and telehealth. 6 things popped up and they were weird. They weren't what we think of in terms of telehealth. So the section, what?
Our report didn't show.
Not in the Measure Clearinghouse.
Oh, okay.
So then in Tele-ED measures that were actually for telehealth, nothing. So when we looked at, going back to our domains, a lot of process measures in terms of Tele-ED, some outcome measures, not much else. These were the places where we were able to find clearly defined measures. So we did the systematic review, we looked for the measures, then we used an NQF sort of process to actually score the measures. We found about 400 of them. NQF wants to know if it's reliable, if there's evidence that it's valid, clearly defined, that sort of thing. We went through that whole process. We were able to narrow it down. And then HRSA supports 6 grantees that are using ED telehealth. And so we worked with those grantees, give us some feasibility information. We got it down to 25 measures. Then we got a new project from HRSA that said, okay, that was really nice conceptual. Now really work with these grantees and get them to report this data. So we went through another process of really talking to the grantees, lots of phone calls. What do these measures, are they really going to work for you? Can you pull these out of your EHR or your ED log or something like that? And the measures that work best, that they're used to, are those ones that are the standard CMS measures. And so this is just an example. We ended up with 25 measures, but this is an example for every patient that comes in. They're used to documenting this sort of information. And so that was the easiest. You want feasibility if you're doing a multi-site study. And so it was feasible for them to be able to extract this sort of data and report it to us, which they are doing. And Rob from the University of Kentucky was here, Jamie from UC Davis. They're 2 of our sites that are wonderfully involved in this. So we revised, TPART was the name of the tool that Mathematica came up with in a Excel spreadsheet. We revised it based on working more with these grantees. We asked them to go back in time and found out that our tool was set up for ICD-10, and there was a date when they switched to that, so they've gone back to that point in time. It's going on right now, and they're prospectively reporting those and transferring data to us, and we'll be able to do fabulous stuff with this data. That's the idea. But we're in the sort of the middle of the data collection right now. So, based on that experience and based on HRSA's portfolio, what they are now funding is 21 school-based telehealth grants. And again, each one of these, the 6 grantees for ED, have multiple hospitals that are reporting into that hub. Same with the 21 school-based. And we've got the resident experts, Steve and Amanda, in terms of school-based expertise to help guide us in this. So what we're doing is we've done the literature review, we've done the search for standardized measures. We're in the process right now, netted about 500 of those. Actually, it was 1,000 and got it down to 500 by a first level of screening. We've got a due date by the end of the month where we have to go through and do the process of scoring. The idea is then We will, again, work with the 21 grantees, get them all involved in scoring a much reduced set, we're hoping, and come up with a set of measures that then can be used with those grantees so that there's a common set of metrics that all the grantees are reporting on. So we borrowed NQF's whole process, but NQF, it turns out this past year, decided that telehealth was a really cool topic, and they had not come up with telehealth measures. So they've put together a group, and Judd and Steve and I get to be on that group, and a bunch of other smarter people, and we are charged with coming up with a framework. So they have done, NQF has done that systematic literature review, and we've reviewed it all. They've gone and looked at standardized measures that exist, and this is all of telehealth. And we've looked at a set of domains and went back to that AHRQ set and have come up with something that's similar. And the idea is just to come up with a framework. It's a one-year project, so it's just the structure for how to do this. It's not actually getting to the point of identifying the measures, and I'm assuming that's going to be, if we're successful, that's going to be a next part of it. So I have a team to thank.